Today we're going to be talking about Buddhism and animal euthanasia. So with the culture of Buddhism, meditation is key. Buddhism is thought to be beyond a religion, but a way of life and a philosophy of life. Four noble truths are what are followed as part of Buddhism, and they are based on what the Buddha taught. The first truth is life is suffering. The second is suffering is caused by craving and aversion. The third is suffering can be overcome and happiness attained. The fourth noble truth is the Eightfold Path, which is a way to achieve happiness and end suffering. The moral code for Buddhism includes the 5 precepts, which are: do not take a life from a living creature, do not take anything that is not given willingly, do not engage in sexual misconduct or sensuality, do not speak untruths, and do not lose mindfulness. Some of the main values and beliefs include karma, which is based on cause and effect; wisdom, which is understanding that no phenomenon is permanent; and compassion, which is sharing and giving of oneself.
While people in Western culture may prefer to choose euthanasia over a slow, painful death for their animal, Buddhists believe that it's necessary for each soul to struggle through the pain in this life and complete the cycle through a natural death to advance in the next life. They believe that if a person kills an animal, that person will not only take on the animal's bad karma and experience the same pain in their next life, but they will also cause the animal a spiritual setback, causing them to be reborn as an animal again and have to live through the same karma again. It is, however, acceptable for a veterinarian to relieve pain through the dying process.
I will now explore the practice of euthanasia in primarily Buddhist countries, using the example of Thailand, a country which has as much as 94.6% of the population of the Buddhist faith. In Thailand, euthanasia is very rare. Legally, it is neither expressly allowed nor prohibited. There are many doctors who refuse to perform it under any circumstances. However, in America, the majority of clinics offer 2 options for clients when their animals are going to undergo an anesthetic procedure: CPR or DNR, do not resuscitate. In Thailand, CPR is always attempted, and often for longer than it is performed here. When these differences are looked at, there are 2 major questions that come to mind. Does the absence of euthanasia as an option lead to better care? Does the absence of euthanasia lead to needless suffering?
Buddhism was first introduced into the U.S. West Coast in the 1800s. As of 2015, there are 488 million Buddhists worldwide. As of 2014, 1% of Colorado's population is Buddhist. The next highest states include Hawaii with 8%, California with 2%, and all other U.S. states make up 1% or less of their population. In 2010, the population of Buddhists in North America was 3,860,000, which is a 1.1% increase. The average age of Buddhists is 30. 66% of Buddhists fall into the ages of 15 to 59. It is projected that by 2050, the Buddhist population in North America will rise to 6,080,000, which is a 1.4% increase. This displays a growth of 2,220,000 people, a 57.6% increase over 40 years.
How do we treat, as vets, these animals while acquiescing to their owner's wishes? First, we must recognize that the owner is seeking help and therefore cares for their animal. The last thing we would want is for the animal to be abandoned at this point in their life to suffer alone. The owner seeking help and making the last hours, days, or weeks as comfortable as possible while adhering to their belief that ending life is morally wrong proves they love their animal and want what is best for them. There is no need to force our beliefs on them or make them feel guilty for following their beliefs. If we make the clients feel uncomfortable or judged, they are likely to leave the clinic, and the animal is still dying and is still in pain. We haven't helped anyone if we do this. We also must understand that this is not unlike physicians that cannot euthanize their patients when they are near death. Our counterparts in human medicine that are dealing with end-of-life patients understand that their treatment needs to center around keeping the patient as comfortable as possible. We treat to minimize pain and suffering, provide fluids and pain medication, and provide palliative care. We show empathy to the client and their pet just as we would with anyone going through the loss of a pet. Whether we believe that euthanasia should be used or not, Recognizing and showing empathy that the client is losing a companion and that this process is no easier for them than it would be for us is paramount in what providing good veterinary care is about. Treat everyone involved in an end-of-life situation with compassion.